The MinSCAT medical and dental services for the new normal. Manned by nurses, dentist and a physician, the college clinic caters its clients from 7:30 a.m. until 5 a.m. during weekdays. The clinic personnel, however, is at on-call basis during emergencies or if necessary. When visiting the clinic, the client must comply to the following: wearing of protective gear such as face mask and face shield, spraying of alcohol to both hands with the provided alcohol by the door, and disinfect shoes before entering the clinic. Disinfecting shoes before entering the clinic on the provided footpath. Maintaining 1 meter physical distance. Signing into the logbook provided. After rendering first aid to the client, there are times that they need to lie down and have them observed closely by the health personnel. At this point, the client will be advised to stay in the recovery area until their condition stabilizes or upon appropriate referral has been made. If a client demonstrates any symptoms related to COVID-19 or other similar highly contagious disease, he or she shall be given an N95 medical face mask and shall be brought to the isolation area. Clinic personnel shall wear appropriate personal protective equipment while assisting the client, and shall refer the case to the Barangay Health Emergency Response Team, as per Department of Health guidelines in handling a suspected COVID-19 patient. Protected by plastic barriers, the dental area will be kept well ventilated throughout the procedure. Disinfection shall be done every after client. The dentist will wear a protection in addition to their face mask, to ensure that the eyes, nose, and mouth are all protected from exposure to respiratory secretions during patient care encounters, including those where splashes and sprays are not anticipated. Online consultation is available through the clinic's Facebook accounts. Dental consultation and extraction is by appointment, to maintain physical distancing inside the clinic. Oral cleaning and tooth restoration is temporarily unavailable, until recommended dental equipment is acquired. This is to ensure safety of both the client and the dental health personnel. Update on the availability of services will be announced in our Facebook page. For wounds that breaks the skin, tetanus toxoid and antitoxin will be administered to the students, employees and nearby community clients. When wound cleansing and packing is done, the initial dose of medicine is given without charge. If the wound needs stitching, the client will be referred or conveyed to a healthcare facility. The medical team conducts first aid and basic life training in coordination with the Disaster and Risk Reduction Management Unit, as preparation for disasters and medical emergencies. This equipped the participants with set of knowledge and skills on responding to real-life crisis. The college clinic also conducts semi-annual misting against dengue-carrying mosquito to provide a safe environment to its populace. The college clinic conducts quarterly water potability testing to detect water contamination by harmful chemicals or pathogens, in order to assure safe drinking water for the MinSCAT community. If the client is not able to do consultation and follow up in the clinic, the medical personnel will visit at their dormitories or boarding house for assessment and treatment. During vehicular accidents or other health emergencies, the medical team will respond and treat the client depending on the available healthcare equipment and facility. The clinic issues medical certificates to students for free. Usually, the medical unit requires a medical certificate to be filed as their health record, which is updated every semester. Medical and physical assessment certified by the college physician is also required on some college events that demand strenuous physical activity. For on-the-job training students, additional psychological test conducted and signed by DOH accredited psychologist is required. Again, these requirements are only asked depending on the approval of CHED and college administration on the said activities and events. Other services in the clinic includes blood pressure checking, blood glucose test or blood sugar test, and IVF administration.